Hey guys, welcome back to another episode of Dr. Rant. Today we're talking about an article in MedPage Today. This was published back in April of 2024. It's November of 2024 today when I'm shooting this video. But it's talking about basically how the Senate is scrutinizing these physician staffing firms and their private equity owners and how Homeland Security is investigating them and that they may be jeopardizing the nation's response time to national emergencies such as the COVID-19 pandemic that occurred. Basically, here's a picture of the Michigan senator that is kind of leading the fight on this is Senator Gary Peters, who's also the chair of Homeland Security and Government Affairs Committee. And he's going after basically Blackstone, KKR, and Apollo Global Management, which are the private equity companies that own TeamHealth, Envision, and U.S. Acute Care Solutions, as well as LifePoint Health. These are basically TeamHealth and these other companies are staffing companies that employ emergency medicine doctors as 1099, so independent contractors to work in the emergency rooms around the country. And basically what they're saying here is there's concern that these private equity companies are cutting staffing hours at these emergency departments, causing long wait times, causing people to basically die in the waiting room is the concern and have bad outcomes. And it's a very good article talking about, basically how, they have seen increased wait times and, problems reflected in patient care when these private equity companies take over emergency departments and staff them up. Here's one of the contributors to the article. They interviewed Mitch Lee, who's got a company called Take Back Medicine. Basically that, he has these concerns. That's why he started this whole organization. And that basically they're, really arguing, all these emergency doctors are arguing to get these companies out of medicine. And there are a lot of states have laws that say corporations can't employ doctors. Doctors have to be employed by other doctors or work for themselves. TeamHealth and these other private equity companies have basically found a way to circumvent these laws by creating shell companies that they put a doctor in charge of it. They don't call the company TeamHealth. They'll call it like, Missouri State Physician, Emergency Physicians, or blank state emergency physicians company. And that company will actually be the ones employing the physicians. And on paper, a doctor owns that company, even though that doctor is owned by TeamHealth and is in charge of reporting to TeamHealth, and they can always replace them if they need to. And there's really not any way for this to be fixed because state licensing boards can't go after a corporation to prevent this from happening. The Attorney General of the state would have to go after the corporation. And of course, Attorney General, can a lot of times be bribed or they don't necessarily want to do that. So this just hasn't really happened yet where, a state medical, they don't really have any reason to do it, but a state medical board would. So this, basically they've been getting away with this for, 10, 20, 30 years now. And, the unfortunate thing is impossible for a patient to know when they go to an ER whether, one of these big companies is employing the doctors there because they don't really list this information publicly. I'm sure if you Google your hospital name that you're going to and, TeamHealth or Envision or USACs, you might be able to find it. And sometimes they have like their name on their white coat, those kind of things. Might be able to tip you off, but at that point you're already there. You've already checked in. You've already waited several hours because, emergency departments run by these companies have really long wait times. And they do things like here they were accused of, doctors at a certain hospital said, we've had really long wait times because these corporate entities have been cutting staffing, leading to long wait times. And then basically these private equity companies come back and they say, oh, the median door-to-doctor wait time is 25 minutes, and it went down in 2024 to 17 minutes. And that's kind of a misleading figure because they're counting the time your door. They basically have a mid-level provider like a nurse practitioner or PA that just sits up front and says, hey, what are you here for? You say, my belly hurt, my abdomen hurts. They say, okay. They listen to your breath sounds. They write a one-sentence note. And that counts as your door-to-doctor time, even though nothing's being done for you at that time. You don't get to go back to a room. You have to sit in the waiting room. Those kind of things are happening. And they basically find these metrics to circumvent that are very misleading, this median door to doctor time. And that also doesn't count, sure, like maybe at 2 in the morning, the door to doctor time isn't very long, but on a Monday afternoon, when it's usually the busiest time in most emergency departments, door to doctor time, that's when they really need more staffing, and they're not staffing more in order to increase profits. So it's a very interesting article. I'll put a link down to it in the description below. And put comments down below if you guys are interested, have any questions. Make sure to like the video if you like this kind of content, you want to see more of this stuff talked about on YouTube, because there really aren't a lot of videos talking about problems in medicine on YouTube is what I've noticed. So I decided to do this kind of channel. Again, I appreciate you guys watching. Make sure to subscribe to the channel, like the video, and I'll catch you all next time.